Hello, hello, hello. Assalamu alaikum. Good morning. Khushamdi. Ji ayanu. Goeiemorgen.
Bakhair agale, ni hao, chunashume, washmale, Ohio Gonzaimes, Guten Morgen, Hola, Bonjour, Privyet, Kaifa hal, Hale Shoma Chatore, Ahlan Wasalan Marhaba, Buna, Mucho, Gracias, and a very amazing good morning to everybody who's tuned into PTV World and are watching World this morning alongside the very amazing, the very talented Shiza Hashmi and Shahzad Khan. Hello Shiza, how are you today?
I am great. How are you?
Well, I am trying to feel great because of the fact that I think that last night when I was about to go to bed, so obviously, you sleep on your bed, right? So I think that I've slept longer on my left-hand side,
Oh,
so my left leg is actually feeling a bit numb. So, and I tried changing my sides, but eventually I don't know that because, when you're sleeping, obviously you're not that conscious.
right.
So I
Absolutely.
kept on reverting back to my left-hand side, and yes, a little bit of pain, but it's perfectly all
I
right.
hope you do get completely better because it's Friday and we're headed out to a weekend.
Yeah, we are headed out to a weekend, but unfortunately, well, not fortunately or unfortunately, it's hard for me to decide or you to decide. But you've got working weekends as well,
Yeah,
and I've got
but I'm
working
used to
weekends.
it now,
Yeah,
man.
so I'm getting used to it because I think at the same time you have to get used to of the fact that I won't be here on this Monday. So yeah,
Yes,
thank you very much for watching my back on that too as well.
no
But what
problem.
about you? What are your plans for the weekend?
As you've already mentioned, I'm going to be working on the weekend, but there's one thing I need to talk about. I
Sure.
think I already did with you, but with all of you.
Yeah.
So there are days in your life when you don't feel like, accomplishing things that you must. And there
Yeah.
are days when you don't feel the right energy to do things.
Exactly.
And one of those days was yesterday for me. I'm pretty sure a lot of you saw. Anyway, so I feel like in whatever phase of life you are, your immediate family are the only ones who are going to stand beside
Yeah.
you in whatever thing you're going through. They're going to be there for you, and you're never going to be alone. Only and only if you have your mother and father and siblings.
Exactly, that's very right as well. And I think I've got something very interesting to add on to this too as well, and
Okay.
that is that. So my car's brakes weren't working properly, so I had to take it to a mechanic or to a workshop. So the car went over there, and the mechanic said that it's going to take like another 2 or 3 days to get it sorted.
Okay.
So earlier today, when I was about to leave my home, my parents asked me, "Oh, so when are you leaving for Faisalabad?" And I was like, "Okay, I'm going to be leaving for Faisalabad today."
Right.
And my parents actually have decided to go to Murray
Okay.
because my father retired and they wanted to take a
Oh
break.
wow.
And then all of a sudden they said, "But how are you going to go to Faisalabad?" And I
Yeah.
was like, "Probably public transport."
Right. Right.
And then they said, "No, no, no. We can probably delay our trip and you can take our car." And I was
Wow.
like, "No, I don't need it. I will still make it to Faisalabad." But ladies and gentlemen, this is where you feel that it's only your family or your siblings or your near and dear ones who
Exactly.
actually look after you in a way where it makes you feel very special. So, and I think it's your responsibility to reciprocate the same way where I wanted my parents to go for their trip and continue with that.
Exactly. So what are we talking about today? I'll
Well,
tell you. I'm
yeah,
not I'm not revealing you will, but I'm just saying because PTV is one of the places where we educate you. We
yeah,
love to inform you and educate you early in the
exactly.
morning. So today we're talking about something very stigmatized, something not very talked about,
Yeah,
especially something very frowned upon
yeah,
in our society especially.
exactly.
But today happens to not today, actually it's tomorrow. The 1st of
Yeah,
December happens to be the 30th anniversary of World AIDS Day, and this is
exactly.
observed all across the globe. A lot of countries are a part of it, participating in this by arranging seminars and informing people, awareing them about it. And Pakistan happens to be one of those countries who are actually observing the day.
Exactly, and Shiza, at the same time, I think it's very unfortunate for Pakistan that we are, I think, the second last or the last country on the entire globe where polio
Yes.
still exists as well. But talking about HIV, I think that it's about time that we actually start paying attention,
Right.
because, ladies and gentlemen, the figures are staggering and the figures are going up
Absolutely.
as well. Especially talking about Asia Pacific, Pakistan, there's 45% increase. In Philippines, it's 175%.
Wow.
And then in Malaysia, it's 9% increase as well. Now, as a matter of fact, when we talk about this increase, it's majority of the time it's because of the fact that people do not know their status, whether they are
Exactly.
HIV positive or not. And this year's theme is Know Your Status. And for anybody who's actually going to go to any public hospital or clinic, you'll get to know that, all the entire treatment's free. And the best part is that the therapy is there, which is antiretroviral therapy, and that's for free too as well.
Right.
Plus, yeah, plus the best part over here is that, ladies and gentlemen, earlier in the day when people didn't have this much of awareness, people thought that HIV is actually going to take their life away.
Right.
That's not how it is. The treatment is available and you can make just small modifications in your lifestyles and you can live a healthy life. But then at the same time, the most important issue is that you do not transmit the same disease to your baby or to your partner.
Exactly. So we're not living in the Stone Age anymore, as you've already mentioned that we have a treatment now, and we're also developing vaccines for prevention.
Yeah.
But right now, the present stats of Pakistan, around 150,000 reported cases of positive HIV exist, and 10% of them are only getting the treatment. How sad is that?
Yeah, and well, it is very sad, and it is sad because of the fact that not more than 25,000 people have been registered with the same infection. And then for all those people who do not even have an idea of what's actually happening to them till the time they're very symptomatic or they're ill, they're not going to the doctor. So I mean, even for me, that's something which I was thinking about my own self while I was preparing for the show, that why shouldn't I go and get myself checked up? I mean, there's nothing wrong in it.
Absolutely.
Why do we actually have to be ashamed of the fact that if there's something wrong with us? Things happen, life goes on. I think that's the type of perception we need to have, and we need to develop, and we need to give awareness to all those people who are out there and destigmatize the entire concept of what happens when HIV takes place. I mean, it's not like that if you share a meal with somebody who's HIV positive and you're going to get it. And and the other thing is that people over here perceive that it might be because of the fact that people are having sexual intercourses and they're not protected. It's not like that. You go to your barber, a single cut can actually get you HIV positive, or you inject medication by yourself and the syringe wasn't what do we call sterilized?
Yes, sterilized.
You can still get it. So please make your minds clean about the fact that it's not always the dirty thing which happens. It can be anywhere and it can infect anybody.
I mean, it's not like if you're going to sneeze and the next person sitting next to you is going to catch it. It's either through, you've already mentioned syringes, it's through sexual intercourse, and also it's hereditary.
Exactly.
So if your parents carry the virus, you're going to get it as well.
Exactly. So to discuss all of these things, ladies and gentlemen, we've got some very amazing and apt guests who are actually making a difference within Pakistan, with their existence within Pakistan as well. And then there are local people who have actually built up a community where they go to people who actually live with HIV as well, and then they ask what are their issues and how to make their life better as well. So on my right hand side, we have been actually joined by the National Manager AIDS Program, Dr. Basir Khan Achakzai. Hello sir, assalamu alaikum, sange.
Thank you.
Thank you very much. Thank you very much for joining us. And alongside Dr. Basir, ladies and gentlemen, we have been joined by UNAIDS Country Director, Pakistan and Afghanistan, Dr. Maria Elena Filio Borromeo. Hello, hi, how are you?
Good morning.
Good morning. Thank you very
so
much.
So impressive with your introduction.
Really?
Thank you very much. Thank you very much. And last but not the least, ladies and gentlemen, we have been joined by Mr. Asghar Sati. He's the National Coordinator, APL HIV, where I was talking about people living with HIV. Hello, sir. Assalamu alaikum. How are you?
Assalamu alaikum. Good morning.
Thank you very much for joining us.
Really, you are well educated, I would say.
Thank you very much. So we're going to get our conversation started with Dr. Maria over here. Okay. So Dr. Maria, since you're the one leading in Pakistan and Afghanistan and talking about or probably raising awareness about HIV, how are the figures and how do you think that, what kind of reaction Pakistanis need to have in order to cope up with this challenge?
No. Okay. Thank you for that question. I think it's good to set the tone.
Yeah.
The epidemic in Pakistan is increasing.
Right.
New infection, as you have just said, the estimated number of people living with HIV is about 150,000 people.
Yeah.
In 2017 alone, there were like 20,000 people estimated to be living with HIV.
Wow.
That means in a month you have about, 55? And so I think after this 1 hour discussion, there will be another 2 or 3 Pakistanis infected with HIV.
Yeah.
So that's how the epidemic is holding its footprints in Pakistan. It's evolving, and like in other countries, it's moving. You mentioned already the dramatic increase in other countries.
Yeah.
And here it had increased in the past 7 years for about 45%
Right.
increase. The epidemic for now is what we call concentrated, but very focused on people perceived to be practicing high-risk behavior.
Okay.
And these are people who inject drugs, they share unclean needles and sterilized, as you said. People who are in the sexual network.
Right.
And so we have men who have sex with men, gay men and other men who have sex with men, female sex workers.
Right.
And now we're also seeing an increasing trend among transgender people.
Right.
So
Okay.
this is kind of the epidemic scenario. Where is this happening mostly? Here in Pakistan, it's mostly happening in two major provinces, in Punjab and in Sindh.
Okay.
Okay, so that's the kind of, in a way, it gives us a very concrete action forward, because then we could put intervention in this specific population and this in a specific location.
Right. But do you think there's ever going to be control of it in the near future for Pakistan, or are we like heading towards a major epidemic?
There could be a major epidemic.
Right.
We might be en route to that.
Okay.
Depending on what we do now,
Okay.
the shape of the epidemic will be will determine what we do now. It's either we act now, or we do not, act now. Then the
Then it's
shape
going
of
to
the
be too
epidemic.
late.
But
Right.
I think currently there are a lot of efforts from under the leadership of the national government, both from the federal and in provincial.
Yeah.
Not only from the Ministry of Health, we also have other ministers who are really engaging.
Okay.
We have the media partners, we have the parliamentarians, we just have a dialogue, and they committed to contribute based on their mandate in ensuring that the HIV epidemic will be controlled.
Right.
I think important also in this whole discussion is to ensure that people living with HIV, people who are affected by the epidemic, are central.
Right.
So we need to ensure that we listen to what their issues are and understand their needs, so that the national program, the provincial program that will be designed, implemented, will really be tailored fit to what they need,
Right,
and therefore
absolutely.
will be more effective and will make a difference in their lives.
Thank you very much. And before I move on to ask about NACP's role as well, there's one thing which I wanted to ask, and that is that you mentioned about parliamentarians, government being on your side as well. But we have seen a lot of such promises being made in the previous eras as well, but not fulfilled, and then the policy being made, but not implemented. So how do you see? Do you think that the commitment this time is 100% in all honesty?
Yeah, as you said, it's really the implementation. I've seen this in other countries where there are policies, where there are AIDS law,
Yeah.
and sometimes it stops there. So we need to continue pushing, advocating that we call it law and paper will be a law in the street. So it should be applied, practiced. The spirit of the law actually will be meaningless if we do not put it into action in the field. So I think here I see and I feel the sincerity.
Okay.
So I think that sincerity we could capitalize and really push that forward. So then they will be able to help, translate that piece of law into practice.
Exactly.
Right, right. Thank you for saying that. But coming to you, Dr. Basir, the theme, know your status. Now, for a country like Pakistan, I'm sorry I have to say this, but this is very stigmatized, and people who even do find out that they are HIV positive, they're not going to talk about it. They're not going to let their, people around them know what the issue is. And just a few days back, I was just discussing this with you as well, that there was a drama on Pakistan television about HIV/AIDS and how this girl got it and the husband then as well. And I know a lot of people warning each other not to watch it, and parents warning their kids of not to watching it. How do you think Pakistanis are going to perceive this, know your status?
Actually, first of all, thank you very much for inviting us.
Thank you, sir.
Actually, we are living in a state of denial.
Right, absolutely.
HIV is a viral disease,
Yeah.
and this virus, throughout the world it exists. And fortunately and unfortunately, Pakistan is a population of 200 million plus population.
Yeah.
And so many of our people, they go around into the world for their business, for their work, for their studies, for so many other issues.
Right.
And secondly, our socio-cultural behavior here in Pakistan towards a disease is a little bit different. Like, they are not treating HIV as a disease.
Okay.
They have just attached it to something which is, God forbid, unethical and which is not allowed in our society, but it is wrong.
Right.
The perception of the people regarding HIV is wrong. HIV is, for example, I will just say one thing, that nobody is immune against misfortune.
Yeah, absolutely.
If you just got an accident and you went to an hospital, and in hospital you got a blood transfusion, or you have been injected 2 or 3 injection, or and that was not sterilized, or the blood was not screened. So God forbid you can take HIV.
You're prone to it,
and
right.
a child which is not still born, which if he is born, he or she got this HIV from her his mother.
Mother,
So
right.
it is unfortunate. But we should realize this, that this is a virus which exists in the world, and it can come to Pakistan, and we are affected by that. And second thing is that we have a big population. So therefore, when we went to each and every spot in Pakistan last year, and we got the estimated number. Now this number is dangerous for us in the sense that if, God forbid, currently the HIV is confined with 4 or 5 risky behavior people. If it went to the general population means, for example, a sex worker, or a men's sex worker, or a transgender, if he transmit this virus to a normal human being, and he goes to his family, and he then infect his wife, or then from wife to children. So if it went and spread to the general population, so it will be beyond our control.
Exactly.
We do not have that much resources to spend on that. Currently, we are requesting the people that please, if you are having the risky behavior, or you fell into some sort of these kind of incidents which I have mentioned, so please come forward, have your test, and if positive, so start your treatment, which is completely free all over Pakistan in more than 50 or 60 centers.
Wow.
We have treatment center as well, and we have testing center as well, along with our other partners. So
That's great.
people
And
should
it's
come.
completely free for everyone who comes
Yes,
there.
this is
Wow.
free.
But sir, now moving on, there's one more thing which I wanted to ask, and that is that a lot of times, issues which are very relevant to our health, or we are very concerned about them. Now, what happens is that since the 18th Amendment took place, the obviously federal and provincial have their own decision-making powers. How do you think that it will actually hinder the process of making people aware in different provinces or within the federal, or not?
Actually, like a healthcare provider, we know our role, that which role we have to play. You are very right that the healthcare services is the responsibility of the provinces now.
Yeah.
Okay.
And provinces have their own resources through the general, the main kitty of the federal government. We are here, the federal ministry.
And I'm sorry to say, but I think I have to be honest with my job as well, and not all provinces are treated equally by the federal too as well.
Yeah. So that is, it depends on, it is a political issue,
Yeah.
as well, and whosoever are politically well aware.
But
so
we
they
need
can get this
political
share.
commitment on this issue,
Yeah,
right?
the political commitment, I must say you. For example, just tomorrow you will see that the Prime Minister or the President, they have shared with us their well wishes
Wow.
and their messages to us, and their pledge as well.
Yeah.
Yesterday, our Federal Minister, Kiani Saab, he came to a very big gathering, and he reiterated, and he assured that each and every type of support from the federal ministry, federal government would be provided to the provinces and to the other partners. And he also assured that certain legislation will be done at federal level.
Okay, that's great. Well, let me move on to Asghar Sahab over here, because once I read about APL HIV, I was very happy of the fact that there are people who are actually looking after the entire community of people who are infected with HIV. First of all, let us know about that. And then the other question is, why do you think that there's this uprise in the HIV infection within the certain population groups?
Okay. Thank you very much for giving me the opportunity to speak on this very important but I think very sensitive subject.
Right. Indeed.
So first of all, I would like to share one information with your viewers that with the support of National AIDS Control Program, our organization is providing 24/7 basis helpline.
Okay.
If you can also,
Sure, what is the number?
So the number is 0800
0800
22209.
22209. For all those people who are out there, if you have any query related to HIV infection, this is your hotline. You won't be there upfront, so nobody will be looking at you as well. Ask as many questions as you want. It is for free. 0800 222
09.
09. Please make sure that you call, okay?
And we have a turnover of almost 40 to 45 incomings call daily.
Wow.
Oh, okay,
Yeah.
okay.
So coming back onto what the APL HIV is, basically APL HIV is a representative body of the HIV community from all over Pakistan.
Right.
And it has over 12,000 registered people from
Okay.
all over Pakistan, from each and every district, I would say. And we basically work to ensure that these people at the end of day contribute positively towards the society and they live a healthy life. So that is basically the focus of our all efforts. And our all programs, our all efforts, they are directed under 5 strategic directions. So we have 5 strategic directions which basically drive our all efforts towards serving the community. And these are, number 1 is research. So that means that we collect evidence right from the grassroots level and share it with the decision makers, policy makers, program implementers, so that the programs, they are tailored to the needs of the communities. That is number 1. Number 2 is advocacy. So now once we develop this kind of evidence, so we use that evidence for advocacy purposes to advocate with the government, with the federal government, with the provincial government, even with the UN partners, that where we need to invest, how we need to invest, and what really the needs of the communities are lying at what corner. And the third thing is basically that we carry out the monitoring and evaluation. Monitoring is basically the services that are being provided to the HIV community and associated key population, whether by the public sector or by the private sector.
Please do share what are those services,
Yeah.
because the services are for free indeed.
Yeah, basically all services are free. So services, once we say services, so this is a complete package which starts from free of cost HIV testing, and it goes up to treatment, right? Which is again free of cost. So, I mean, within the government sector, we say, so there are almost 33 centers which are providing free of cost testing, counseling, and treatment services, and over 20, services from within the community-based organization. So I am coming on to that. So that is basically the monitoring whether the services are, as per the needs of the communities or not. And secondly, the most important thing that we observe during that monitoring is whether these services are free of stigma and discrimination. Then what we do is that we analyze our, data that we get from these monitoring reports. We identify the gaps, and we share it with the provincial and national program control programs. So we also provide them with some kind of recommendation that how more development can be made to further improve upon the services. So that is the third part of it. Then another is empowerment and independence. So empowerment, basically we are working for the empowerment of the communities, so that these are the people who are basically unvoiced. These are the people who are unheard. So we want to provide them with some kind of platform where they can raise their voices in unison, and they can speak about their issues, they can speak about their rights, they can speak about their needs, and they can contribute meaningfully at the policy and the decision-making level. So for that, just I want to share that in last couple of years, with support from UNAIDS, I'm thankful to them, and with the support from National AIDS Control Program, we have provided separate platform to the drug users, right, who are basically the main driver of the epidemic in the country. We have also provided a separate platform to the positive female, because they have specific issues, right? So they need to be addressed with their lenses. So we have provided them. Now, the latest evidence that indicates a huge infection within the young people, right? So we have provided a platform to the young people as well, where they can sit together, they can discuss, and they can contribute in HIV response. So that is basically empowering the communities. And at the end of the day, basically this will contribute towards reducing the stigma and discrimination and increasing the access to the services. And the last is basically, that is the independence. That is something related to the APL HIV, that we are the representative body of these communities, so we should not be, dependent on any one partner. Rather, we should have a kind of an independent role, so that we can, if we would be independent, so we would be able to basically raise their concern in more effective way.
And they'll feel motivated too as well in order to get their treatments done.
So the other part of your question, that is that why the infections are, at increase. So I think there are multiple reasons, and we can speak about it, hours and hours. But I think from community perspective, there are 4 or 5 important things that need to be kept in mind. Number one is the social taboo, the myths, the stigma and discrimination that is attached with this particular disease. People have a prejudice, they have a preset mind that this is because of the sexual activities, though it is not like that. That's number one. Number two reason is basically, and normally I call that people basically they don't accept their status.
Yeah,
They are
they're
in
in
state
denial.
of their
Yeah.
denial.
Yeah.
For example, you are there, might be you are having some kind of risky behavior, but you would say that it can't happen to me. So you are in state of denial. So basically, this state of denial is one of the major reasons within the key populations, which
Yeah, and I'm going to add on to that as well, where, ladies and gentlemen, we said that, there are different ways through which, the infection can actually be transferred to your body. So I think that for all those people who are in denial can only think of one of the ways. So please make sure that you do not do that, and it's a very common mistake. I'm definitely going to come back to you, but over here, ladies and gentlemen, we definitely have to go out for a short break. And there's this one alarming thing which I wanted to say, and that is that, the name of the program is National AIDS Control Program.
Yeah.
But AIDS is actually on an increase within the country. So what kind of control program are we actually even talking about? I think
Yeah.
with this, we need to go out for a short break. And when we come back, obviously, this will be going to be a little bit of hard talk with Dr. Achikzai over here.
Yeah, and also we're going to discuss the lifestyle of people who are already living with AIDS and how that can be normalized for people who don't have AIDS, and then they can probably socialize easily. So stay tuned and good morning.
Good morning.
Welcome back, ladies and gentlemen. You're watching Well this morning with Shazad Khan and Shaza Hashmi, and today we have taken up a very important but stigmatized and sensitive topic.
Yeah.
Ladies and gentlemen, the 1st of December is observed as the World AIDS Day all across the globe, and today that is what we're discussing. And in the first segment, not the first segment, in fact, before going on the break, we discussed the reasons that cause AIDS, the people who live with AIDS, and how the prevalent conditions of this specific disease in Pakistan are. And are there any treatments or preventions for that?
Yeah, so now moving on, ladies and gentlemen, before going towards the break, there was this one question which I had, and that is that the government representation we have over here on the show is by NACP, which is National AIDS Control Program. But it is not very unfair to say that I think that we have miserably failed because there's 45% increase in the newer infection cases. And the name of the program is AIDS Control, but it's nowhere somewhere near to be controlled as well.
It's
And I
increasing,
think,
yeah.
which is why I think I'll have to move on to Dr. Achizai over here.
Yeah, just sensing our responsibility, for example, I can challenge for the last 5 years, not a single day, as Sati is sitting over here, that we have short of medicine or short of any test related to HIV/AIDS, number one. Now, number two is that why the people are not coming, why we are not reaching to more and more people.
Yeah.
There are so many obstacles involved in that. The first and very important, which we realized during 2018 with the coming of this new government, that why not let's start a new strategy, and that strategy is that now we are working directly with the communities.
Okay.
The people who are infected, like the sex worker, the female sex worker, the transgender, injection drug user, now we have taken them on board.
Okay.
17 organizations who are working for these communities in all Pakistan,
Yeah.
we are now directly working with them.
Okay.
Like, look, for example, if you are ashamed that your resistance to our entry into your sports and your settings, now we have hired them and we have given them training and services and the testing materials. They are now going to their communities, and the result of that is, alhamdulillah, very positive and very good.
Wow.
In 1 month time, we have almost done more than 500 tests in two or three CBOs, this community-based organization, and they are now finding and taking cases for us to be treated.
So what you can do is that probably, you know, on national television, you can make us a promise, and that is the next year when we sit down together to talk about AIDS, probably we shouldn't be talking about increase, we should be talking about decrease. So do you promise?
The treatment, I promise that the treatment would be available, and the people, it is not only the government responsibility. The UN agencies, the FLHIV themselves, the other societies, stakeholders, civil society, the people which we diagnose, if they come, that is my promise that 100% treatment will be for them free and cost. And one last important thing,
Sure.
that we are even supporting those families who comes for treatment and they are poor. 100% the data shows that HIV people are very poor.
Right.
So we are supporting their families by their education, by their children,
Okay.
for their food,
Wow.
and for the transport to the HIV treatment centers.
Wow.
That's
So this
great.
is the government which we are doing.
Wow, that's brilliant. But you know, coming to Miss Maria,
Could I just add
Yeah,
to
yeah,
that?
please,
Sorry,
please, please.
because I think it's a very important component of the national program.
Yeah.
But the other issue that you raise is about control.
Yeah.
And there are 3 modes of transmission of HIV.
Yeah.
We all know that. So control measures are those measures or activity that would cut the transmission
Right.
from one person to
To
another.
the other,
Yeah?
yeah, right.
So this is, I think there's a lot of effort going on. So let me just highlight some of the important
Sure.
effectively proven preventive measures that
Yeah.
would include consistent and correct use of condom,
Okay.
sharing of, or not sharing, sorry, sharing of
Syringes should not be
syringes,
Okay.
no, it's needles,
not be reused.
using clean needles,
right.
or sterilized needles. And then there is now what we call prevention of mother-to-child transmission, where
Right.
there's also a pill
Okay.
that you take and then you stop transmission from mother to child. So these are the measures, the preventive measures that would really effectively control the epidemic. And the control of epidemics in some countries had been done. Cambodia, we have only less than 100 new infections happening every year.
Okay.
Okay, we also have Thailand. So this could be done. And
Right.
Pakistan knows it. Pakistan has the tools and all the available resources, I would say.
And
That's
one
Right, Miss
success
Maria?
story about regarding to aid and to Marian. that in Pakistan, the percentage of from mother transmission to children, it is only 3%.
Okay.
We have stopped that, alhamdulillah. Out of 100 deliveries taken place in government hospitals, only in 3% it has been transmitted and the treatment is started. So this is a big story.
And
Out
that
of 100,
definitely deserves a big tap on your back too as well. Congratulations on doing that.
No, but
just I
Miss
want to
Maria,
add
I'm so sorry I have to cut you down, but this, my question is in line with what we were already talking about. But Miss Maria, you know, in Pakistan, a lot of population lives in the rural areas. And there's this term quacks, who are not professional doctors or, you know, proper doctors. So a lot of people do go to quack doctors, and what they do is use unsterilized needles and, you know,
yes,
use
very
the wrong
important, very
instruments.
important.
Also, one more thing, the social health workers in the rural areas are actually sensitive to this topic. Like, they don't want to talk about it. So what do we do about that?
Okay, so first is the practice of quackery.
Yeah.
And I was really surprised that in this part of the world you still
exists?
have that.
Right.
And then I also started reading and asking people, and even some researchers in Lahore. And they really say that they have some very good example. They did an epidemiological investigation, and true enough.
Okay.
And I think we need to look at why are people in the rural area continue to avail of services from
Right.
quack doctors.
Yeah.
And I understand, and I may be wrong, this is mainly because there is very limited health services available for them 24 hours a day.
Okay,
Yeah?
okay.
So when a mother, I talked to a mother, she continued to avail of the services of quack doctors because in the middle of the night, when the child, her baby got sick, has some stomach pain or whatever, then there is no one that they can call to except a
Right.
quack doctor who would come directly in motorbike any time of the night, give injections, and this is where, you know, the issue is, give injections and we don't know what was injected, and true
Right.
enough, the following day they're okay, the baby's okay, but even they can even opt not to pay first, you know,
Yeah,
and
yeah.
then they pay after 2 months or 3 months.
Right.
So these are the issues surrounding this practice. And so I think the government, and this had been a lot of discussion, and this has really to be strong in terms of regulating or educating.
Now,
Right.
in all
Yeah.
Pakistan, all provinces, the healthcare commissions has been formed. In Punjab, they are working a very great job, and they have got hold of all the issues. In Balochistan, they have the healthcare commission in which no practice of such people will be allowed. In Sindh, they are doing a legislation, and in KP, they have already done it.
Right.
So hopefully, when the federal government also do some legislation here, it is Islamabad, the capital. So maybe this will help.
And I think that they're listening to us too as well. So Asghar Sahib, you wanted to add?
Yeah, I just wanted to add with regard to the question that you asked to Dr. Basir Saab. Basically, the National AIDS Control Program, I think they are contributing very positively, right? So that kind of thing needs to be replicated at provincial level. That I would say. I'm sure might be the provincial programs. Somebody from them is hearing. So that is spirit is needed to be replicated at the provincial level, and that is number one. And number two, with regard to quacks and that, I think the laws and the legislation they are already there. But what we need is basically implementation in true spirit.
Definitely.
Exactly.
That's
Right.
what-
Thank
Now,
you
Mr.
very
Sat-
much. Yeah.
I'm so sorry. Now, Mr. Satya, I also want you to shed some light for people like me who are not, let's not say misinformed, but uninformed about the conditions that people with HIV live in. How normal or not normal their life is, and how
Or
should
can be, yeah.
Yeah.
Well, the people who are infected, their lives are basically normal,
Okay.
right? But once they step out to the society, so the abnormality that comes in.
Right.
That is because of the attitude of the society. And even let me tell you, and let me share you even personal experiences. Once these people go to the healthcare services,
Right.
they find a lot of stigma and discrimination there as well.
Okay.
So basically, these healthcare
They're
settings.
judged.
Sorry?
They're judged over there,
Yeah,
right?
exactly. They are judged over there, and if somebody comes from within the specific key population, so he or she is judged and treated
Right,
accordingly,
right.
right? So that kind of attitude then discourages people to contribute positively. That is one. And on other hand, I would say that basically the communities, these infected and affected people, also have some role to play in
Okay.
that, and that is that they have to break the silence, basically break the silence that surrounds this disease.
Okay.
Because if they are going to break it, definitely they will have positive outcome.
Right,
And if
right.
they won't break it, let me assure you, nobody come and will break for them.
Exactly.
Exactly. Thank you very much for saying that. And towards the end of the show, ladies and gentlemen, I think I've thought of one good solution as well,
Okay.
and this message is for all the aid agencies who are out there, and that is, so when I used to be young, my father never gave me more than 5 rupees or 2 rupees so that I could not actually go outside or probably buy a cigarette for myself when I was a kid. And I think this was his way of treating us so that we do not actually fall into a fate where we cannot come back out. So I think for all the aid agencies, rather than giving us the money, I think just provide us with the facilitation or probably just make sure that we have everything at our end to treat people with. I know that there can be reactions with the government too as well, because aid is important too. But for whatever we require in order to cater to all of those people who are infected with HIV, just provide us with that, and I think things will work fine. But one last question from Dr. Maria before uh, signing out, and that is, since you've got extensive experience and you're heading the program in Pakistan and Afghanistan as well, what do you think is the need of the hour for Pakistan to do now and act promptly?
I think I will say three things.
Sure.
Implementation, implementation, and
And
implementation.
implementation.
Right.
That's it.
Enough said.
Pakistan has the knowledge, they know the tools. Pakistan embraces innovation. Now Pakistan is starting pre-exposure prophylaxis.
Okay.
It's a new tool. It's a new strategy where even before you are infected, you can already take some pill. But there are some criteria. Yeah.
Okay.
So and Pakistan is not, I would say, stingy in having all this. They're so open.
Right.
But I think the challenge is really implementation. You have policy, you have, implement, monitor, as he said,
Yeah.
and then adjust the program
Okay.
accordingly. So I think that's the message from my end.
Very nice.
And certainly, as this is World AIDS Day, I would say make every day a World AIDS Day.
Exactly. And know your status, ladies
Know
and
your
gentlemen. This is very important. Thank you very much, Dr. Achakzai. Thank you very much, Dr. Maria. Thank you very much, Mr. Asghar Sati, for joining us on such an, well, it's not the exact day, but it's going to be tomorrow. But still, I think we have set the route and everything's going to be perfect too as well. So for all those people who are out there, please make sure that you know your status and there's no harm in it.
Exactly, and one of the things that I established from this discussion is that the people who are actually living with HIV are living a normal life on their own, but the only problem they face is the society and
Exactly.
inclusion. So do not be one of the people who actually, judge others for living with the condition, or be supportive, because they are a part of your society and they do need your support.
And they've got a role to play. So do write
Exactly.
to us on our Facebook fan page, which is with the name
Well
of,
This Morning.
on Twitter,
Well This Morning without a G.
on Daily Motion and YouTube.
Well This Morning.
And this fabulous repeat's going to be at
11:05 in the night.
And yeah, that's what it is. So till the next time, ladies and gentlemen, 1, 2, 3.
Good morning.
Thank you very much.